Hello, everybody, and welcome to another episode of the Atlantic CIL podcast. I'm your host, Donald Campbell. Of course, I'm the director of the Atlantic CIL, and we have a great guest, one of my favorite people, one of the original board members for the Atlantic CIL before she retired after many years, probably felt like decades of service, Jaime Angelini. How are you, Jaime?
I am doing so well. It's so good to see you. And yes, I love that I was an original board member when the CIL started.
You were you were very original. I think you put the original board together. I think that
worked on that grant and helped compile the board. Yeah. So
if you like this podcast, you can really thank Jaime for a big part of it. We're going to talk about a very important topic today. I think it's an essential topic. It's suicide prevention, and just a quick trigger warning for anybody who may be triggered by discussions like this. We're going to cover these topics. We're going to talk about them seriously, and just getting that out of the way. But I think it's very important to talk about because we still don't talk about it enough. So, Jaime, tell us. You're with the Mental Health Association in New Jersey. Tell us what you're doing. You're working on suicide prevention. Tell us what your mission is, what you've been doing.
Absolutely. So currently I am the statewide director of suicide prevention, crisis response, and special projects. A lot of the work that I do is around mental health training and education, and specifically, like you mentioned, suicide prevention. So we are doing a lot of work in the community, training gatekeepers. And that's the important part, is that sometimes people think to learn the warning signs and to learn how to talk about suicide, you need to be a mental health professional or an expert. Absolutely not true. When we talk about gatekeepers, we're talking about friends and families and neighbors, law enforcement, people that work in social service agencies, teachers, everyone. So really trying to get the word out and have people really get evidence-based training around recognizing warning signs and being able to talk openly about suicide, which is so important.
Yes, that's so true, because there's still a lot of stigma about it, but there's like really important, discouraging statistics about, especially since the pandemic, people's mental health conditions. You know, it's more prevalent than we like to think, and it's more prevalent than we like to talk about, and the worst thing we can do to ignore it. So I love what you're doing by really opening the discussion. And that's what I wanted to talk about too. So how prevalent is thoughts of suicide? Because I think some people think it's unusual still, that, you know.
Yeah, and it's not unusual. A lot of people think about suicide, but we don't have to act on it. If there's support, if people recognize the warning signs, I think part of what you said is that stigma that we have to work on reducing. There's so much stigma around it, and that keeps people from reaching out for help, and that keeps other people from asking someone else. You know, when we look at the statistics, the most recent stats that just came out in February from the CDC let us know that more than 48,000 people in the United States die by suicide each year. So this is happening. Sometimes if it hasn't impacted someone's life, they think it happens somewhere else. It happens in someone else's community or someone else's church or someone else's family. Suicide does not discriminate. It can impact any one of us. And a lot of people are impacted in their lifetime. So, you know, one of the things that we really want to do is push through that uncomfortable conversation. We always talk about that it's hard to talk about suicide. It's uncomfortable, but it's needed. And when we talk about suicide prevention, we're talking about hope and action. So even though suicide might be difficult to talk about, suicide prevention is full of offering hope, because if we recognize the signs early, if we have the courage to ask someone the question about suicide, we know we can save lives. So when we're training gatekeepers, and we do an evidence-based 90-minute training all over New Jersey, and we focus on, we do it for adults, supporting adults, but right now we have a grant for adults supporting young people and teenagers. So we're really trying to look at what are those warning signs for young people, and to not be afraid to ask the question, are you thinking about suicide? And we practice that in the class with people.
Right. So that's awesome. Let's talk about those. Let's start with those warning signs. What are those warning signs that people should think about training themselves to notice if somebody
there's a lot, and it's not a checklist. Sometimes it's kind of these pieces of a puzzle, I say, that we're putting together. We first want to listen, for verbal clues. We'll call them clues, warning signs, what someone might say. We may hear someone say directly, I'm thinking about suicide, or I want to kill myself. But we also might hear someone say something like, I'm tired of my life. I just can't go on. My friends, my family, people would be better off without me. I'm a burden. So when we hear those warning signs, stop and ask some questions. And then we look at, behavioral clues and behavioral warning signs. What's different? Is this person giving things away? And everyone has heard that as a warning sign, giving away prized possessions, gathering the things they need to end their life, medication or a weapon. Are there situational signs? Have they lost their job? Have they lost a friendship? Have they, had a recent loss, a death? And especially if by suicide, someone else in their family or a close friend, there's a lot of things we can look for. We always look for sudden changes in mood. What's different? Unexplained mood changes. And again, these may not all be signs of suicide, but they're worth asking, hey, what's going on? I'm worried about you. I'm concerned. Also, I think, Donald, it's important that we let listeners know that we've really shifted language around suicide. So you'll always hear me say, and you'll hear Donald say, that someone died by suicide. So in the field, but not just professionally, personally, people have really shifted language. So they're no longer using the words committed suicide. Right. We want to talk about suicide neutrally. We want to take the stigma away. So I encourage people to model that language and say someone died by suicide. Say what it is. Someone killed themselves. But we don't want to say committed suicide. We don't ever want to say successful suicide or a failed attempt. So just those shifts in language are also really important in reducing stigma. So I wanted to mention that.
Yeah, I think that's really important because the old language really kind of put it a lot on the person who did it. Like, it really emphasized they did it, which, suicide, as we've learned, is really the last stage in a mental health crisis or a serious severe depression. So, it's not, the person on the person, and we're really trying to shift that away. So let's talk about, you hear those warning signs, and I think what you said too is listening is very important, which is, I think, hard for a lot of people.
Sure.
And so you hear that warning sign. So what should you do then? Should you freak out? What do you do? What do you do? Somebody says, I feel like, I'm a burden, which I think is a real key. I really zoned in on that language because that's when you start shifting in your mind to, I don't deserve to be here, kind of, that I'm not worth being here. So what should you do?
And I think it's important you mention, don't freak out, even if you're scared inside. And many of us are. This is scary stuff. And suicide is so complicated. But if you hear the warning signs, stop and ask some questions. If in doubt, don't wait. We always say that. So if something inside you says, I need to ask about suicide, I'm worried about this person, do not wait another minute. Do not wait another day. Ask them. If you can't, that's okay. Tag in someone else. Maybe for whatever reason, you can't do it. You have a different relationship with the person than someone else, or you're going through your own stuff. Tag in someone else. But if you're going to sit down and open this conversation, do it in a way without judgment. Offer hope. Ask the person directly, and say what you've noticed. Hey, Donald, I've noticed. So if I'm talking with you, I'm going to say, I've noticed that, you've been crying a lot at work, or I've noticed that you said everyone would be better off without you. I've noticed some changes in your mood and I'm concerned and I'm worried. And I need to ask you because I care, are you thinking about suicide? So if you're worried about someone, open this conversation. Don't wait. Give yourself plenty of time to sit with that person, allow the person to speak freely, and do this without judgment. So it's not the time to say, you'll ruin everyone's life. How could you do this? You have so much to live for. And we say that because we know it's true. When someone's thinking of suicide, we know they have so much to live for. We know they're not a burden. But when someone's in that type of emotional pain, they can't see any other way out. There's kind of like these emotional, painful blinders on. So when we can open that conversation and allow the person to tell us how they're feeling, and if we ask someone if you're thinking about suicide and they say yes, start by saying thank you. Thank you for telling me. Thank you for sharing this with me. And then go to that next step. And we teach this in the class. Okay, what can we do to keep you safe? Will you go with me to get help? Will you let me help you get help? And then we talk about what that help looks like. And we give people resources and we allow them the time to practice and role play in the class so that if you're asking someone, you feel more confident. Even if you're scared inside, you can get the words out. And I think practicing the words, are you thinking about suicide, is really important. Most people have never said that in their life to anyone else.
Yes. And I know that I have in my life had to ask people both professionally and personally about it. And it is very hard.
Yeah.
And it is you really got to you take a step back and you're like, okay, I'm going to ask this, and you got to be ready for whatever answer comes. And I love what you said about, not making it kind of judgmental about that would be really selfish, or, you're not thinking about everybody else, because that doesn't help. That makes people shut down and close on it. And you want people to talk and listen and feel validated. But once you started making it about you and how it's affecting you, they're like, oh, a lot of people shut down. So another myth that I wanted to say, and you can talk about this too, is a lot of people still think if you ask them about it, that's going to give them the idea to do it, which is so untrue. But I want to give you a chance to talk about that, because I think that's what causes people to stop too. Like somebody's going to say, well, I wasn't thinking about completing suicide, but now that Donald asked me, I guess I'm going to go out and do it. So talk about that.
And Donald, and that's a myth that many of us grew up with, thinking that if we talked about suicide, we would give someone the idea. If we asked them about it, we would plan it in their mind. It doesn't work that way. The research backs this up. And everything that I teach, everything we teach in the classes is grounded in research. So what we know is that if we ask someone about suicide, we lower their anxiety. We open communication. We don't put it in someone's head. And that's a myth that's floating out there. Someone's either thinking about suicide or they're not. When we ask about it, we're letting them know, hey, I notice you're in emotional pain, and I have enough courage to ask you. But that is a myth. There's lots of myths out there in the class that we teach, QPR, and I know you've taken it, Donald. We go through all those myths and facts. Things like if someone talks about it all the time, they won't do it. That's a myth. People sometimes say, oh, I know someone, they talk about it all the time, they're not going to do it. The fact is, if someone's talking about it, they're thinking about it. So we take all signs seriously when it comes to suicide. But again, I'm glad you brought that up, because if we can clear up some of those myths, people are more likely to reach out and offer support to someone else in their life.
Yeah, I think that's a particularly destructive myth. The other myth, they're just doing it for attention. They're kind of what you talked about, which is, another really destructive myth. If somebody's talking about it, you should address it and say, I notice. So let's talk about those resources. So somebody says, yes, what is the best, because we'll put some resources in the description as well. What is the next step for getting them in touch with some resources?
So the great thing now, and this, and hopefully your listeners do, is that we have 988. So as of last July, you no longer have to dial the long 10-digit suicide prevention lifeline number. We can now just dial 988 and immediately get connected to a counselor. You also can use the crisis text line and text 741-741, and a crisis counselor immediately writes back to you. And again, we'll post all of these resources. Another great resource is to know what's happening in your county, to know where the mobile crisis is or the screening center. You can also call 911. If it's an emergency and you're worried about someone, you can call 911 and they can connect you with crisis. They can connect you with your screening center. They can come out and you can ask, hey, can you please send an officer who has mental health training? We're so lucky in New Jersey because so many of our law enforcement have mental health training. So I would say have those resources ready to go if you're going to have this conversation. If this is someone in your life who you know, and they have a counselor or a clinician, have their number handy and say, let's reach out. And I think the important thing is if you can reach out together, that's really helpful. Sometimes we just have to make that emergency call, and that's okay. But if you can empower and encourage the person to do it with you and say, okay, who should we call? Let's call the crisis line. Let's call the lifeline and talk a little bit. And get some of their advice and their guidance. But yeah, I think definitely having resources handy, and 988 is a wonderful resource nationally, but we have call centers right in New Jersey.
Yeah, that's great. And I love that we even shorten the hotline, which the easier it is, the less barriers it is, the better. I also wanted to talk about, there's this wonderful article you sent me from NJ Spotlight News that we'll link to also in the description, that talks about how suicide disproportionately affects certain communities, particularly the LGBTQ. And then another layer of that is minority groups, African Americans, people of color, and others underserved backgrounds. So really talk about that additional stigma that really exists in more underserved communities that I think is still very prevalent. I mean, if you look at the numbers between the LGBT community and the heterosexual community, I mean, the disparity is really striking. And I wanted to talk a little bit about that.
Yeah, absolutely. And I'm going to drop a report into the chat that you can share with your listeners. So one of the things in the suicide prevention work that we are doing, we are looking at youth of color and also youth who are part of the LGBTQ plus community. So I'll start by talking about the Ring the Alarm report, which came out in 2019. I encourage people to take a deeper dive into this report. One of the things that it tells us is that over the last several years, I'm going to read it right from the report, data has emerged indicating an alarming increase in the suicide rates for Black children and teenagers over the past generation. While research is also showing climbing rates for youth of other racial and ethnic groups, this trend in Black youth runs counter to historical data showing lower rates of suicide of Black Americans. So it's really challenging that public perception that Black youth simply do not die by suicide. And these words that I'm reading are taken directly from the report. So, you know, for many years, we were told that we didn't have to worry so much, you know, about young Black people or young people of color. And again, I'm using words from the report, not my own. Yeah. And it challenges that perception. So we have to really look at the rising rates in youth of color. The other piece that we talk about a lot, and I'll drop this into the chat also, and you can share this, are young people who identify as part of the LGBTQ plus community. And we looked at the Trevor Project survey 2022. So this just came out, the national survey, and I encourage people to take a look at this. And what it tells us here is that 45% of young people part of this community seriously considered attempting suicide in the past year when they were surveyed. 14% attempted suicide. It goes on to say in some of the key points, and we know this information, but we have to remind people who are working with young people that youth who are part of the LGBTQ plus population who felt high social support in their families had less rates of suicide. You know, those who felt that they were in schools and communities that were affirming had lower rates of attempting suicide. So again, it just goes back to, are we creating respectful, accepting, affirming communities and schools? So yeah, I'm glad that you brought up those two special populations because we talk about that in our training and we specifically cite those two reports that I just talked about.
Yeah, and that is why, you know, not to get on my soapbox, but we're really going to think about these laws we pass and these, you know, these communities we create where people feel stigmatized if they're in underserved communities, because it's, you know, a lot of people, you know, you'll still hear a lot of people say, well, what's the big deal about the pronoun thing for the LGBT community, for people who are transgender? Well, because you're sending a message when you do that you are accepting and that you are affirming they exist, and that is making them feel welcome. So even though if you're not transgender, that you don't really understand why that's important, that's why it is that, and that's why the LGBT community is particularly concerned about these laws coming out of states like Florida, and there was one in Tennessee focused on drag shows. This is very concerning stuff, and I don't mean to get totally on my soapbox, but it sends the message to these people, particularly young people who are struggling with acceptance, that there is something wrong with them and that they shouldn't be accepted. And we want to create societies that make them feel comfortable to be
Thanks,
who they
Donald.
are.
And it's your show, and I love that you're on your soapbox because this information, it's so important. If we are going to truly support young people in our community and we're going to create a safety net around suicide prevention, we have to talk about this stuff. So thank you.
Yeah, I just think it's really important. And, you know, somebody you love is a part of this community, chances are. So we really just got to think about that stuff. So I just think this is great. Now you go into schools, correct? And how, so let's talk about some of the positives. Are people more open to these discussions now? Because you've been doing this for years. You've been in this subject for years. Or how's the youth? Are they more open to talking about this? Is
Yeah.
there good news about that?
Absolutely. So in general, people are more open. So we're focusing on suicide prevention, again, for adults, supporting adults, adults supporting young people, suicide prevention in the workplace. We have a special curriculum for that. People are more open, and our young people, I'm glad you brought up the teenagers, and I'm a mom, I have 2 teenagers, and that's what drives me to do this work. I say that all the time. Our young people, they are more open to talking about it than one might believe. They, in the schools, there are programs around suicide prevention and teen mental health. So our young people are learning the warning signs. They're learning how to ask a friend or a peer, are you thinking about suicide? And most importantly, what they're learning is to get a trusted adult, always tagging in a trusted adult, not to keep that secret about suicide, even if you think your friend's going to be mad at you, and they might be. You've got to tag in a trusted adult. And sometimes young people say, well, I don't know who to go to. So one of the things that we do when we talk with teenagers is create a circle of support so that you have all the people there that you could go to. And if you're worried about a friend and they don't have a trusted adult, you can say to them, hey, we can go to my trusted adult. And maybe it's their school counselor. Maybe it's a parent. Maybe it's an aunt or an uncle, or a favorite teacher. But when we talk with teenagers, we want to really make sure that they are getting that trusted adult if they're worried about someone. And that's if they hear another student or a peer say something or post something on social media, get someone immediately, and to not be afraid to talk about suicide. And they're really open to it. They're open to talking about mental health and wellness and self-care. So it's really nice when we have time and opportunity to talk in the high schools.
Yeah, that gives me hope.
Yeah.
That gives me hope because I've really noticed that shift, and also about just being more accepting of other communities and other like we were talking about LGBTQ. Like it's just a lot more open now. I mean, I was born in the 90s. Even then, with me, I've seen a good positive shift. So that has made me very hopeful. You brought up social media. I think that's an important factor in all this, or maybe not. How do you think social media has negatively? Do you think it's been a net negative for our youth in terms of suicidal thoughts and stuff like that? Because a lot of people point to that as a big culprit for the increase, and I just wanted to get your thoughts about both the negative and positive of social media. Kind of where do you think that factors in, if you have any thoughts?
Yeah, and again, these are just my thoughts and opinions. No research based here. I think, like adults, it depends how we use it. I think when we as adults are using it responsibly, we feel better. And when we're not comparing ourselves to others, I think we feel better. But many adults and teenagers can fall into that trap of looking at everyone else seemingly living their best life, and then we feel like we're not. And if someone's already struggling or experiencing depression or anxiety, mental health issues, and they're then falling into that worry of everyone else is doing great and I'm not, then it could be negative. But we also know there's feel-good social media. There's wonderful apps and there's wonderful, funny TikToks and things that make us feel good, ways to connect with people around mental health and wellness. So I see both sides of it. And, when I talk with adults and teenagers, oftentimes they say the same thing, that it can really help my mental health if I use it the right way. But other times, it feels negative. So I think it can go both ways, Donald. It's hard. It's a hard one.
I agree with you. I think it's a tool, and like all tools, you can use it in a positive way or a negative way. I know we do a social media workshop at the CIL for the young people we work with, and my phrase is always, and this, I didn't come up with this, but that social media is not real life. It's not real life.
Yep.
It's a distorted version of real life, and you really have to, when you're looking at that, know that. You really have to look at that and know that, and you really have to use your tool, that if it's making you upset, that's a sign to walk away from it. Yeah. And also, but it's also a good thing in a lot of ways, because a lot of people would not get connected to resources that they would otherwise have. It used to be, if you were in a smaller town, you could have been the only transgender person you knew. Whereas now you can easily go on a Facebook or a social media or TikTok and see that really you're just like everybody else, and there's nothing, that there's a whole community out there for you to support. So I always just tell people, especially young people, to just use it to your benefit. Don't get sucked in it, and realize that it's not real life. And I'm really happy you're doing this. I'm really happy that our state is embracing it. I think New Jersey is kind of ahead of the curve, which I think is a good thing. What do you think more can be done to prevent people from completing suicide? So do we need more resources at this in mental health? What do we kind of need broadly as a society?
So you mentioned, New Jersey is ahead of the curve. We do really well. We have one of the lowest rates of suicide when we look at across the country. However, one death by suicide is too many, and we know that. But we are rich in resources. We have to keep the conversation going. So we have a lot of prevention programs in New Jersey. We have to continue to embed them into communities, into schools, into workplaces. One of the pieces of the work that we do is to really look for community champions who could become suicide prevention trainers like myself, and then really go right into their own community and continue this conversation. So one of the things that, what we could do more of is just having more conversations, continuing to have the narrative around it's okay to talk about suicide, and starting with mental health, having open, honest conversations about mental health. Mental health is something we all have. We do not all have or experience mental health challenges or mental illness, but we all have mental health. So talking about it and focusing on caring for it is so important. So I think a piece of it is the training and the resources and the education that's happening formally, but informally, just those conversations people can have in their own home, in their place of worship, in their community, in their workplace, to just talk openly about mental health. I think the more that we do that, again, I always say we're creating a safety net for people to feel safe, to come to any one of us. And we are then hopefully having more gatekeepers that are looking through the same lens of a potential warning sign, and having the courage to say to someone in their community or their workplace or their school, I'm concerned about you. And just, starting from there.
I love that answer, because that costs nothing. We don't have to change a law. We don't have to do anything. We just have to talk about it, talk openly. And it's just so important because, like I loved what you said about we all have mental health. We may not all go through mental health crisis or have particularly mental health disabilities, but we all have mental health. And we've lived through very traumatic times recently. The pandemic and has been a traumatic event for a lot of people. And it is a traumatic event. And it's just important to check on yourself and to check on the people around you, because it is amazing how we as a society have just kept going, even though this traumatic event has happened on top of other traumatic events.
Sure.
And that's going to affect anybody, because we're all human. We're all human. So thank you so much, Jaime, for coming and doing this. Is there anything else you want to have people take away from this? Anything else you want to say? Any resource? Anything you want to send them to? If not, that's okay too. I just want to give
I encourage everyone to look into our gatekeeper training. It's designed for anyone and everyone in our community, especially those who are working with and supporting young people. Go to our website, mhanj.org. Donald, you can definitely share my email address when you link this, and some of those resources that we talked about. Educate yourselves around suicide prevention, and don't be afraid to ask people in your life if they're thinking about suicide. If you're worried, ask them today. Don't wait.
Yeah, trust yourself. Trust yourself. Yep. Like you said, don't wait. So thank you all so much for listening, and I will see you all next time. Thank you, Jaime, for doing this.
Thank you so much.
See you later. Bye.